pointer?
Okay.
Mic.
All right, great. This is on. Okay, hello, awesome. Okay. Yeah, I'm super happy to be here. Big thank you to Jeff, the CHAMP1 Foundation leadership or conference organizers, and all of you, the families, for being here and giving me the opportunity to speak to you today about the Simon Searchlight Research Program. So for those who may not be familiar with us, or if you need a bit of a refresher, Simon Searchlight is an international research program with the goal of accelerating science and improving lives for people with rare genetic neurodevelopmental disorders. And I'm definitely biased, but we do have an excellent team working behind the scenes with clinicians, researchers, genetic counselors, engineers, communication specialists, all hopefully creating a positive research experience for you and your families and helping to generate important scientific and clinical insights in CHAMP1 and other conditions. So ultimately, what are the goals of Simon Searchlight? Our mission is to shed light on these conditions by collecting high-quality, standardized natural history data and building strong partnerships between researchers, industry, and families. So we do that first through collecting detailed medical and behavioral histories along with blood samples. We synthesize that information that you provide, and we share those results back to you as the families. We then de-identify and secure the data that you've shared, and then after doing that, we freely share that data and samples with qualified researchers who request access to that data. We also connect researchers and participants from around the world, so hoping to create opportunities for you to participate in other research if you so choose. And ultimately, all of this is to promote better understanding of these genetic changes. Now, Simon Searchlight is a genes-first cohort study, meaning folks enroll in the study with a genetic diagnosis that's on the list of our genes that are typically associated with autism and other neurodevelopmental disorders. And we're fully funded and supported by the Simons Foundation Autism Research Initiative, or SAFARI, which is also housed within a bigger umbrella nonprofit organization called the Simons Foundation, focused on basic sciences and mathematics. And alongside Simon Searchlight, within that SAFARI umbrella, we have some sister studies and collaborators that we work with, including SPARK, which is a diagnosis-first autism-based enrollment cohort study, Autism BrainNet, which is a post-mortem brain tissue donation program, and SAFARI also provides funding for outside researchers to conduct studies in labs or in clinics, some of which you heard about yesterday. And then all of the research resources collected through these cohort studies are made available to researchers to study in their labs. So that could be animal models, iPSCs, which you heard about yesterday as well, data from surveys, and more. Oh no. Well, that's okay. This was going to be a list of genetic conditions that we study. We have over 180, and the little box there was going to say CHAMP1, so we were highlighting, but that's okay. We also offer participation in English, Spanish, French, Dutch, and more languages are on the horizon as well, including Italian, German, and Portuguese. And in terms of data that we ask you about in the participation in Searchlight, it all starts with the genetic laboratory report. So in order to enroll fully in the study for all of the other surveys, our certified genetic counselors review the lab report just to make sure you're in the right place, and that really unlocks the rest of participation. So that includes contributing data on medical history, previous developmental and mental health diagnoses, medication use, and surveys on other aspects as well, including sleep, seizures, adaptive behavior and skills development, communication, quality of life, and more. And so we ask all of these surveys at the onset when you first register, consent, submit the lab report, et cetera. And then for a subset of these surveys, we also ask for yearly annual updates so that we can learn more about how things are going over time, both in your family and in other CHAMP1 families. Oh. There we go. Okay, apologies. And so for those who have been with us for a while, you might remember that the medical history collection used to be a phone call interview, but now we've moved fully online for that, as well as our other surveys, so not needing to worry about time zones or scheduling a call. Take it at your own pace, because we do ask a lot of questions, though we appreciate your time. And all of this really is to provide important medical information to researchers in the community. And for those enrolled in Searchlight, this will look familiar. This is an example participant dashboard where all the magic happens. So at the top is your family progress bar showing first steps and subsequent steps to complete. That middle piece there, that next priority task, is if you have 5 minutes today, what would we like you to get started on? And so here for Jennifer Doe, a sample, not real participant, it would be their annual medical history survey. And then below that, you'll see other active tasks that we would like you to complete the next time you have some time to sit with us, virtually, of course. And then ultimately, as a token of our appreciation for taking the time to submit this data and fill out these surveys, we do offer gift cards after survey completion, and that's available in the rewards section of the dashboard. And so we're always looking for opportunities to deepen and broaden what we're collecting. So this is a couple of items we're working on, most notably, and what will happen in the most near future is the Observer Reported Communication Assessment, or ORCA, looking at more nonverbal and minimally verbal communication. Oh, this might be a theme throughout the rest of the slides. I do apologize. I'm not sure what's happening with some of the graphics here, but I have talked a lot about information that we ask you to give us. And so the question is, what are we giving back to you? So it's important for us to provide hopefully easier to understand insights based on the data you contribute. This looks like personalized reports on your dashboard for a subset of surveys such as seizure history, social communication, and others. We also look broadly across the community to summarize across all CHAMP1 families in the form of snapshots that we publish on an about quarterly basis, usually focusing on medical history, and then a spotlight that rotates about new measures like the Vineland seizures, et cetera. And then we have opportunities to do deeper dives like this in the data for presentations at conferences and meetings and virtual meetings as well. And I'd like to also highlight an incredible program called Research Match. So this is where we're able to connect researchers to participants. Researchers who are interested in working with CHAMP1 families can contact us for recruitment, and then we can contact you with opportunities that you might be interested in. And if you are, then we make that connection happen with the researcher. And researchers can also add their own surveys within our system. If they want to ask some questions that maybe we don't cover in our Searchlight battery, we can help them develop that survey, distribute out to you all the families. And so to date, across Simon's Searchlight cohort, over 3,400 families have been invited to participate in studies with other researchers. In Searchlight, you can also donate a blood sample. You've heard quite a bit yesterday about the value of blood samples and what that can do to help advance science and medicine. And you may have noticed as well that we were collecting some blood samples upstairs, and I think today might be continuing through 12. But ultimately, we do collect blood samples at these in-person conferences, and then for those based in the US, we can send a sample kit home free of charge. And that would be making an appointment at Quest Labs to have the blood drawn, and then the lab mails the kit back to Simon's Searchlight. And so I won't go too into this because you did hear a lot yesterday about all the great use cases for using blood samples from participants, but shortly, there's a lot we can learn about the mechanism of CHAMP1 from blood. So using whole blood DNA, certain cell lines like lymphoblastoid cells or PBMCs to help make induced pluripotent stem cells or iPSCs, all of this helps advance science in CHAMP1 understanding. And again, I won't spend too much time here because you did hear a lot about this yesterday, but very briefly to kind of synthesize what you might have heard before, really these stem cells are coming from blood samples. We're helping to take this blood, revert it back to a more infant or stem cell-like state, and then adding treatments to it to essentially ask it to become a more mature version of the cell type that we want to study, whether that's a brain cell, liver cell, other tissue cell, and ultimately this helps with understanding the disease better and drug screening and discovery towards therapeutics. Now, iPSCs are an incredible resource. It also is incredibly resource intensive to make them, and so we're really grateful to have this opportunity funded by Safari and the Nancy Laurie Marks Family Foundation to work with our biorepository sampled and the New York Stem Cell Foundation to select a subset of blood, so not all blood, but a subset of samples into induced pluripotent stem cells. And then these can be made available to researchers in their lab so that those researchers don't have to take their money and time to make them. And so we have over 150 lines created across 20+ gene groups. And again, these are available for request today. I'll talk a little bit more about the CHAMP1 cells later. I'm talking a lot about the data we collect, and the question is anybody actually looking at it? And the answer is yes. So these numbers are already outdated, but just at a minimum, we have at least 170 research teams who have looked at our lab report and survey data across all of Simon Searchlight and previous iterations of Simon Searchlight. We have at least almost 100, probably now at this point, 100 research teams looking at biospecimen samples, and CHAMP1 data is included within these request accesses. So basically, if someone wants to download survey data, they can see CHAMP1 data, and they can request CHAMP1 biospecimens as well. And so for any researchers who may still be with us today in the room, more information is available at base.safari.org, and happy to chat as well further after. So for the rest of the time, I will talk about specifically the CHAMP1 registry, what we're learning about CHAMP1 in Simon Searchlight, now that hopefully you have a better sense of what we're up to in the program. So for CHAMP1, we have 55 families who have signed up online and 48 who have provided a genetic laboratory report. So from that 48, we have 41 sharing their important medical history, 40 who have filled out additional surveys, and 5 folks who have provided a blood sample. And these numbers reflect before the conference, of course, so not this weekend. I won't spend too much time here again because we did review a lot of the slides yesterday, but just to give you a sense of who's in the Searchlight cohort, we have 38 CHAMP1 pathogenic and likely pathogenic variant carrying individuals, as well as below you'll see 9 Searchlight participants that have variants of uncertain significance. So just to clarify, I heard there were some questions yesterday. We do enroll folks who have variants of uncertain significance, and we do collect survey and blood sample data from you. It's just that for the purpose of curating these presentations, we do focus on those variants where we're more confident about the association with the condition. And so what we're outlining here very simply, just a quick overview, is overall the protein product yielding from the CHAMP1 gene and the different points of that protein at which a genetic change in the gene would be impacting. So here we're mostly showing in these red lollipops, these types of frame shift nonsense variant changes, and we have a couple of folks with intragenic deletions not shown here. We are an international program, so across all of Simon Searchlight, we have participants from 79 countries globally, and this includes 47 CHAMP1 participants in 10 countries. Apologies again for some of the graphic disruptions here. But we do have in these map markers here the locations of CHAMP1 folks. We do have most of our families based in the US, and for de-identifiability purposes, of course, these are not exact locations, just summary hubs, seeing representation across west through east coast of the US. Now, I mentioned blood samples earlier. We've had 5 participants who have given blood samples, and from there we were able to generate 10 samples distributable to researchers, including 7 iPSCs and 3 whole blood DNA samples. And in speaking of iPSCs, this is a bit of a busy slide, but essentially we have 7 lines across 6 mutations available for researchers to use today. They can, well, I mean, they would have to request it, but they can request today access to these cell lines. We've already had 3 research groups who have requested some of these CHAMP1 iPSCs to further study in their lab. And we have a couple of more where we attempted reprogramming. It was not successful for one reason or another, and we're revisiting opportunities to try again in cases where we might have more blood sample available to try. And finally, I will spend the rest of the talk just summarizing some of the survey data that we've collected so far. This will, again, be only in the individuals with pathogenic, likely pathogenic variants. So briefly, across the medical history submissions, we have 26 individuals with medical history data. This is showing an age distribution. We have 13 male, 13 female, ranging from 1 year of age through to 29. Most of our participants are under the age of 18 with an average age of 7. And many of the next slides will look something like this. So just to quickly orient you, the top is showing kind of an umbrella of what we're covering in the slide. And then along the y-axis or vertical line are specific conditions that we ask about lifetime diagnoses of having. And then the bar is showing the number of people who have reported yes about this diagnosis, as well as the percentage relative to the whole group from whom we have data. So here, the 26 individuals. So for example, if we start right in the middle, everybody who gave us medical history data is reporting having a lifetime diagnosis of, or a diagnosis at some point in their life of intellectual disability or developmental delay. A smaller subset, but still a large proportion of individuals reporting language delay or impairment, a smaller subset reporting autism, and then fewer folks reporting anxiety, ADHD, or obsessive compulsive disorder. Similar rules apply in terms of what the chart is telling us, this time looking at medical issues overall from head to toe. What you'll see is the body systems reflected at the top of the graph are, through the data that we have in Simon's Searchlight, seemingly less impacted, and those further at the bottom of the graph are showing more conditions reported. So, for example, we're not seeing as much in immunodeficiency, structural gastrointestinal issues. We do have one report of leukemia in cancer, but it's just that one individual that we have in our data, and then fewer folks as well reporting issues related to autoimmune conditions, joint problems, and heart-related problems. Joint problems, the most common one being hypermobile joints. We then have some folks reporting seizures and issues with orthopedic conditions, most commonly scoliosis. And then we're starting to see increased numbers when we're seeing issues like genital-related issues, endocrinologic issues, and then most individuals here in that bottom bracket looking at GI issues, mostly GERD and constipation, as well as vision and neurological conditions. So if we dive into some of those bigger blocks at the bottom of that graph, if we expand out to see neurological conditions, we're seeing most individuals, about 92%, reporting hypotonia or low muscle tone, about 40% reporting microcephaly or small head size, fewer folks reporting movement disorder, and then a couple of other conditions coming through, such as tic disorder, different head and muscle size and tone issues, coordination problems, et cetera. If we look at the visual system, most commonly in the Simon Searchlight data, we're seeing farsightedness at about 62%, crossed eyes at about 46%. We're seeing some repetitive eye movements, astigmatism, and a couple of other visual conditions coming through the data here as well. Fewer folks affected in the endocrinologic system, but we are seeing reports of diabetes and failure to thrive, as well as a couple of one-off reports of hyper or hypothyroidism, puberty-related conditions, short stature, and other. And in thinking of the surgeries that people are getting to help treat with medical conditions, about 60% of individuals are reporting at least having some surgery at some point. This is mostly in the head and neck category, and this other category that we essentially need to kind of move some of that data over into better structured categories here. We do have a couple of GI-related surgeries, including 2 folks with a G-tube, as well as some other surgery types listed here. And in terms of medication use, we have data from 22 individuals, so a little bit less than that 26. And this is where we ask about what kinds of medications people are taking and for what purposes. So for example, if we look at that red middle bar here, we have 10 out of 22 individuals reporting medication used to help with gastrointestinal or GI issues. We have folks 6 out of 22 reporting meds to help with sleep. We do have individuals reporting medications for seizures, so some combination of anti-epileptic medication and sedative medication. And then we also have reports of medication being used to help with severe behavior and mood. So this could include neuroleptics and mood stabilizers, which could also be helping to use for sleep. Some reports of antidepressant use, pain, cannabis, and medications for attention hyperactivity. We did ask caregivers if there was a medication that seemed to work best for those who are experiencing seizures, and no single medication stood out thus far as most effective, although I will say these data are quite preliminary, and so more information, thank you, that we can come through, the more we'll be able to report back. And so for the next 5 minutes of the presentation, I'll just quickly review some of the developmental and behavioral data that we have from some of our other surveys, including the Vineland Adaptive Behavior Scales, or Vineland-3. And so these graphs look a little different to quickly orient you. What we're looking at are growth charts. And so what we can capture here is based on the skills that you've shared with us in your Vineland submissions, which thank you for taking the time to submit those Vinelands. On the x-axis or horizontal is showing the actual age of the person that you reported on at the time that you sent us their Vineland. And that y-axis is showing essentially the level of skills that you've shared with us. What age in more typical development might we see those skills emerging? And so each blue dot is a person, and then the lower left dot, for example, that would be someone whose actual age is 1 year of age, and their skill set is at about the level, speech level, of a 1-year-old in more typical development. And so these dots essentially are placed at the level at which people would express themselves for this graph, because it's expressive language development. And what we're seeing based on certain milestone markers that we might be thinking of in those dashed lines, about 2/3 of individuals with CHAMP1 in Simon Searchlight, based on what's reported to us, are likely to be using language at age 4 and older. If we move into more personal care skills, things like dressing oneself, feeding oneself, we're seeing close to 80% of individuals in the data with CHAMP1 are likely to be feeding themselves at age 4 and older, and others can take care of themselves with other more advanced skills as well. In terms of social development, so thinking of making eye contact, creating friends, engaging, we're seeing at least 2/3 of individuals who are likely to be making eye contact at age 4 and older. And again, you can see a distribution of dots showing different skill levels overall based on what we're seeing in the data so far. And then if we move to gross motor development, things like walking, hopping, jumping, most children with CHAMP1 in Simon Searchlight are likely to be walking at age 4 and older. And so I'll wrap up quickly with the child behavior checklist data. This is where we ask about behavioral or emotional concerns you may have. And so we parse this in 2 age groups, the younger age group, 1.5 to 5 years of age. Some of the top behavioral emotional concerns we're seeing pop through the data or rise to the surface of the data are quickly moving from one activity to the next, irritability, impatience, or desiring frequent attention. And in our older age group, these only 9 individuals, again, these are preliminary data sets. What we're seeing come through mostly are obsessions, demanding frequent attention, hyperactivity, and repeating certain behaviors. So to quickly summarize, in our CHAMP1 medical and behavioral data, we're seeing common issues of intellectual disability and developmental delay, language delay, visual and neurological issues, some specific ones coming through most commonly. We are seeing reports of autism, seizures, issues in the endocrine and gastrointestinal systems, and some development, skill building, and behavioral emotional concerns that are coming through as well. And so I'd like to just wrap up by saying thank you so much for listening to me talk, and thank you to those who are participating in Simon Searchlight. We are on all the socials, so Facebook, Twitter, YouTube. If you're interested in learning more about the program, you can go to simonsearchlight.org. That's also where you could register if you're interested by clicking the Join Us button. And for any direct questions, of course, you can find any of us here today, but if questions come up afterwards and you want to reach out, please do contact us at coordinator@simonsearchlight.org. We really are happy to connect with you. And so that email address is down there, and I'll be sitting here if you want me to help write it down for you. So not sure if we have time. If we do, I'll take questions. If not, we can follow up after. Thank you. Yeah,
that's exactly why we tried to keep it so we had time for questions. Before I forget, thank you obviously so much for being here and for giving a presentation. Thank you, Jen, for being here. For Simon Searchlight, and I think we alluded to this yesterday, they're a huge reason why we were able to advance research. Some of the presentations and the variant numbers are as a result of them producing iPSCs for our group, and they've been supportive and here from literally the very beginning of the organization of this foundation and our first few patients diagnosed participating in it. They also donated to this event as well, which is huge as it's an expensive event and it's one of the more difficult struggles for every nonprofit. I had one question, and then Troy's going to pass around the mic to everybody else. Something a few of us note to self to start Sunday a little later. A lot of the guys last night stayed up till 2 in the morning talking, and one of the biggest challenges we have as a community is retention. You get new families, and we all know that life as a parent with special needs is difficult. In some cases, a shower at the end of the day is the victory. So to be able to participate in surveys becomes overwhelming. Families don't pay attention to announcements and emails all the time. You usually get them once in a while for a big push, and then it's very difficult to retain them. And I'm sure this isn't unique to CHAMP1. I know this is a problem across all patient advocacy groups. What is the solution? What is the direction? What can we brainstorm as a way of keeping families involved? And the goal is to be able to do this longitudinally down years at a time, so we're not just getting them half completing surveys and then hard to retain and advance this forward.
Yeah, I could definitely try to take it, but I think it would be possibly even more helpful to hear from the families what might be helpful to retain motivation. I think we completely recognize the burden of that, and that's why we're so appreciative for the participation we do have. We try to re-engage by hopefully providing these summary reports throughout the year as a reminder that these data aren't just existing in the void, but they do actually matter and people are looking at the data. We like to highlight publications when they come out where researchers are using the data to reinforce and remind that the word is getting out there about CHAMP1 and other conditions. And events really like this, I think, are really motivating both for us as the research team to think how we can continue to keep the community motivated and what we should be able to do better to help with that motivation. So we're always open for feedback as well, because we recognize that there are a lots going on, and this is not always a priority, and that makes sense. So open to feedback.
As one who's been part of this since the beginning of this, I still have surveys that are not done, And I think for me, it's not that I don't care about it. I really care about research, but it gets overwhelming. And I think maybe if there was a way to, I don't know, make reasonable benchmarks that breaks it down a little bit more in like, hey, do this survey by this time in 2 weeks or something, like that it's one at a time, because sometimes the mental fatigue of having to make another decision, figuring out how to do the planning of, I got to do 15 surveys, and maybe it would make it more digestible for families, taking that little piece out of, okay, I can do one survey every 2 weeks or something. That might help retain people, just taking that extra little piece out, making it manageable.
Yeah. That's really great. Thinking of ways to make it a little bit more bite-sized and tangible. That I understand that. Yeah, thank you.
I'm just curious, can you access the survey results if, like, we were told they didn't want our sample yesterday. So as just an audience member or a family friend, can I still access the results to learn about CHAMP or what's going on with CHAMP if my sample wasn't taken?
Yes, so any of the summary reports that come out online or like presentations like this are open to truly anybody because they're just on the web and on socials. For more of the individualized reports that would be on the dashboard, that would involve participation in Simon Searchlight, so you would need to register and submit survey data. You can participate in Simon Searchlight without contributing a blood sample, so hopefully that helps answer your question. Yeah.
Anybody else have any other questions?
I'll just add one thing, and I just wanted to clarify. I'm sure we would have loved your sample. I just know that right now there's so many interested researchers, and so I think there was a priority of like, there were other researchers that needed the tubes, and there weren't any extra tubes that we could draw. So, okay, all right, great. I did want to add one thing, just from to your point about like trying to be more direct about what to do when. One thing that we've tried to do the last 2 years is in the month of April, we do a Shine Your Searchlight campaign where we partner with the patient advocacy groups to give out, we've got like, social media posts and draft language and everything, and then all the patient advocacy groups across Searchlight will at the same time be posting like on a weekly basis, like, hey, this week if you haven't registered yet, go in and register. Hey, now if you haven't given your lab report in week 2, please upload your lab report. But it's like much more targeted, and it's across all, and then it also engages the foundations themselves with a lot of that standard message. So that's one way we've tried to break it down a little bit more.
I believe you have time for one more question.
I've also been participating in Simons for a few years now, but I don't know if we've actually done our blood with you. I think we've just done like the surveys. How would I find out? Or did the blood draw that we gave the other day cover Simons also?
Without knowing the details of how your blood draw went through this event, we could maybe follow up. Generally, if the blood sample that was drawn at this conference was for different research teams, then those would sit with those research teams. If it was with Simon Searchlight, then you're kind of all set, and we have that. If you're interested in contributing to Searchlight and the blood sample from today was in a different research program and you're based in the US, we could also connect about potentially sending a kit home and then going to a local quest. But the best way to kind of get your specific details sorted out would be to contact us at the coordinator@simonsearchlight.org inbox, and I have a card I can bring over to you because the team will be better able to see it once it's all laid out like that. Yeah.
Thank you so much, Dr. Katina. Just to also bring to attention something, and I'm going to get yelled at if I don't get up here on camera, but I think this is sort of I want to say a good problem to have, but nevertheless a problem. We've gotten to a point now where we have studies and blood samples and plasma and PBMCs and different types of cell lines at different types of biorepositories. And the difficulty is not breaking any laws and being compliant and not keeping your information de-identified. And it's great that we've had the opportunity to participate in all these surveys and we have these resources for scientists to get now. The difficulty is we have so many, we can't always locate the families, and so that's an issue we're trying to combat, and it's not an easy one. I think one thing we're exploring is some sort of a unique identifier through the CRID. I don't know if it's a viable option. It's something we're kind of consulting with some experts about, but we want to make sure that at some point your variant is linked to your personal identifier, which allows us to know this variant did this survey, this study, this blood draw. So we sort of eliminate any confusion, and we could probably talk through it and figure out. I know I've tried my hardest not to be known as the Dracula of the group, asking everyone to donate blood, but it is so important. I think everyone's starting to see the value. Maybe it's taking a little longer down the road. Couple quick housekeeping, and then I'm going to introduce Danielle to go over a few. I think in the noise yesterday, there were a few really important headlines that got lost. And just to ask all the researchers that are here today, at some point when we get to go through this Q&A, if you could maybe hit us with the highlights of the things you said or that you got from all of the presentations, I think it would go a long way for everybody here and everybody who's listening to kind of summarize these highlights. But there was some big news that was lost. I also want to tell you, we have our videographer and photographer here for a few hours after today. This room is open for the remainder of the day, and we could all sit here, relax, and enjoy, get some coffee. Please take pictures. I think everyone knows our social media by now, but I want to make sure we all take advantage of this so we see the opportunity for memories. But without further ado.
The interviews as well, you need to remember.
Yes, sir.